All right, so getting started with your examination, I do see quite a bit of swelling. So noticing some swelling here, as well as interior, as well as some bruising. So I'm just going to notate quickly. So I think I want to start by having a look with my pen light. So you said that you fell in an attempt to avoid stepping on a small animal, and your x-ray was negative. So the good news is you do not have a fracture, but I can definitely see that this is a grade 2 sprain. So you said it's been about a week now since this happened, exactly 6 days. And I do see that you have some swelling that has begun to heal here, but there is a little bit of bruising here under that ankle bone, as well as on this side. There's quite a bit of swelling here in comparison to your right ankle. So unfortunately, it does appear as if you have sprained it pretty badly. Now, luckily, as stated, nothing is broken or fractured, so there's no indication of injury to the bone. However, there is quite a bit of fluid buildup here, so I'm just going to palpate around the injury just a little bit with my fingers. So this might cause you some slight discomfort. I'm just going to use the tips of my fingers to very gently palpate around the swelling, and at this point I'm just trying to feel for any pockets of fluid or anything that could be more concerning. Definitely looking for any heat spots, as well as just kind of running my fingers across the area. Now, you do have some scar tissue here from what you said was a previous injury, and you have several screws in place. So luckily I was able to visualize those screws in the x-ray, and they are still in place, so that's good news. See a little bit of bruising here. Okay. So just feeling around. So what I'm going to have you do is just very slightly rotate your foot here, just so I can visualize the back of your ankle. Very good. So just like that. Just having a look at this area. It is quite swollen. I'd imagine pretty painful. From the pictures you uploaded to your patient portal, the bruising has healed pretty significantly, so that is great news. Okay, so you can go ahead and relax your leg in whatever position is comfortable for you there. I'm just going to go ahead and notate that. Alright, so what I'm going to do now is feel for your pulses. Okay, so you're just going to feel me kind of brace the bottom of your foot here, as well as place 2 fingers on top of your foot, and I'm just feeling for your pedal pulse. So just relax for me, just breathe normally. I'm just making sure that your circulation is intact. And I am feeling a healthy pulse here, so that's great. Sign of good circulation. No irregularities there. And I'm just going to go ahead and compare that to the unaffected side. Perfect. Okay. Good. So what I'm going to do now is just push down on your toes very slightly. So this is going to allow me to check your capillary refill, essentially applying pressure to the nail bed as well as underneath the toe. in an effort to stop blood flow or occlude it, and then when I let go, I should see a return in that pinkish color, indicating that you do have adequate circulation in your toes. So far, I am seeing very healthy response, so that's great. And then, of course, just comparing that to the other side. Okay, good. All right, so what I'd like to do now is take a couple of measurements so we can see how much swelling is going on. So I am going to have you lift up this ankle for me. Perfect. And right above the ankle bone, we are right at about 9 inches. And I'm going to do the widest part of the foot here. And again, about 9 inches. And then one more here. We're at about 9 1/4. So I'm going to very gently help you lift that ankle. Perfect. Okay. Closer to 10 1/4 on this side. So about 1 1/4 inches of swelling there. I'm going to perform the same set of measurements across the middle of your foot. Right at about 9 1/4 there. Just about 9 inches there. Okay. So most of the swelling is isolated to the ankle area, which is good news. Okay. Okay, so I'm going to go in with my calipers, and this is just a measuring tool that's going to allow me to measure for symmetry again comparatively. So measuring the most affected area first, I'm going to start right at the ankle bone on your unaffected leg. So here. Quite a bit of a difference here. So again, about 1.5 inches to 1.25 inches of swelling. And it does appear to extend about 1/8 of the way up the calf. Okay. Just a little bit of swelling here as well, not quite as much though. Okay, so going in with a different tool, and this is also a measuring tool. This time I'm going to be measuring the plantar portion of your foot. So measuring the bottom of your foot and just checking to see if the arch of your foot has been affected by this injury. I don't suspect that it has, but I do always like to check. So of course, starting with your unaffected foot, I'm just lining up your heel with my marker here, and then lining up my indicator on this side as well, so I know whereabouts to look on your other foot. This is not going to hurt. I'm just touching my ruler to the bottom of your foot, and those markers are at about the same spot, so that's a good indication that the arch of your foot is well intact. So I'm going to flip this over Just a little swelling here. Yeah, okay. So definitely just a little bit of swelling on the plantar portion of your upper foot there. Nothing that I would say is significant, so definitely majority of the injury appears to be on this outside area, as you suspected. Okay. All right, so now I'm just going to have a look at your veins. So just attempting to assess for any possible injuries here. So looking for any abnormal signs of swelling. So what we're seeing now is pretty even swelling. It's swelled over a larger area, and there are not too many areas that protrude out other than around your ankle. So we're not seeing any sort of nodules of swelling, which is what I'm looking for. So I'm going to just run my light along your foot, following those veins, making sure that there are no signs of ruptures or anything otherwise abnormal here. So just having a little bit of a look. Well, that does appear to be okay. And then of course on this side, quite a bit more visualization. So I can see the bone structure here and kind of natural deviations of your foot that obviously I'm not seeing on this side. Okay. And then just having a quick look at the scar tissue, noting any abnormalities that I might see here. So I'm not seeing any protrusions. And we know, of course, that your screws are in place, so there's no worry of puncture. So I want to do a couple tests of your mobility. Can you tell me if it hurts more on the inside of your ankle or on the outside? Okay, so most of your pain is kind of isolated here, but it is uncomfortable on the inside. Okay. Does it hurt when I just kind of barely touch here? Okay. So tender, but you can feel it, not painful necessarily. Okay. But you can feel everything here, correct? So you feel me touching you. There's no loss of sensation anywhere. Specifically in the toes, you can feel all of this. Okay. And does that feel any different from this side? So all of this should feel the same, maybe slightly tender, but you can feel it. Okay. As well as on your toes. So if I squeeze your toes individually here, these two feel the same? Okay. And these two feel the same? Okay. Just making sure that there are no differences in sensation here, so these two also feel the same. Okay. Very good. And plantar, you can feel this on both sides. Okay, good. So sensation is intact, and that would be a big concern. So that is a good thing to go ahead and rule out. Okay. Equal bilaterally. Patient indicates positive reaction to stimuli. Sensation in lower digits appears to be intact. Okay. Very good. So what I am going to do at this point is do a couple tests of your mobility and flexibility. So I don't want to manipulate it too much. Obviously it's uncomfortable, but I do just want to see kind of what we're working with as far as injury assessment. So at this point, you're a week out and you have been walking on it. So that's good. You've been putting more pressure on it. I do just want to make sure that there's no kind of muscle stiffening that could be happening. I know you said you kind of rested and elevated your feet for about the first 4 days, which is fine. Typically, I do like my sprain patients to start mobilizing a little bit sooner, within about day 1 to 2. I'd like to see you take a couple of steps on it at least, just to help get that mobilization in. I know we tend to think that you should ice and rest, and yes, that is true, but it is also important to keep it moving and get those stretches in, okay? So I just want to see how we are doing in comparison to your unaffected ankle. So what I'm gonna have you do is start with this side, and I just want you to press down on my foot. So press down on my hand, perfect. And now pull back on my hand. So pull back towards you. Very good. Now I'm gonna hold this leg up. Can I have you fully rotate your ankle? Perfect, and then the other way as well. Beautiful, okay, so no issues with your mobility there. Are you able to flex your toes out and squeeze them in? Perfect, okay, so no issues with this foot at all. Now, within your level of comfort, I want you to try to repeat the same here, okay? So if you can at all push against my foot like you're driving, perfect, very good. Now pull back towards you, great. Now if I hold your leg up, can you try to rotate your ankle? Okay. So some mobility, but it is lacking slightly. Okay, you can go ahead and relax. Are you able to flex your toes at all on this side? And can you squeeze them in? Okay. So it's likely causing you some discomfort, but you do have mobility here, so that's good news. It's not so stiff that you're unable to move your appendages completely, so that is good. So what I'm going to do now is just run my hands along both sides together, and essentially what I'm checking for is any temperature variation here, okay? So you can relax this foot in whatever way is most comfortable for you, whatever way is the least painful. And I'm just going to run my hands, not applying any pressure really, just checking to see if the temperature is about the same on both sides. So right about here, I start to feel that this side is quite a bit warmer. So there is a little bit of temperature variation there. This foot is cool to the touch, whereas your left foot is definitely warmer. And that appears to carry down into the toes. I'm going to just go ahead and use my temperature gun. And we will start interior unaffected side here. So 92. 98.2, 98.4, 99.5, 98.4, 99.9, 98.4, 99.7. Okay, so definitely seeing a variation in temperature here. Going to move to the top of the foot, 98.1, 98.2, slight difference, 93, 94, 99, 99, 98. a 2 to 3 degree difference here from both sides. So it does indicate that there is some swelling on this side, but of course we knew that. So give me just a second to go ahead and notate there. Temperature variation. Left foot. Interior. 99. Right foot. Interior. 94. Anterior. 2 degree variance. Okay. All right, so let's go ahead and proceed. And I don't want to do too much manipulation of the injury because it's really not necessary and it's not going to help us assess at all, really. So what I am going to do is a very brief reflex check of your large toe here. So okay. So that is intact. And then I don't want to do too much manipulation. I do want to verify that your neurological responsiveness is intact as well. So what I'm going to do is, starting with your unaffected side, I'm going to run a brush up against the bottom of your foot. So similar to this, but it will be underneath your foot, and I'd like you to just allow yourself to react normally here, okay? I'm just testing your Babinski reflex. The reaction there. Let's see if I do that with something a little more specific. So good. Okay, so I did get a response there. I'm only going to test this side with the brush. Okay, so there is our response to Babinski. So that indicates that your neurological functions are still intact, which is very important. And what I'm going to do next is some bilateral sensation testing. Now, this is going to be very brief. I know that you can feel me. I just want to ensure that it does feel the same on both sides, okay? So I'm going to start up here. Can you just indicate to me whether or not this feels exactly the same or different on both sides? So, does that feel the same there? Good. Same. So essentially just indicate to me if and when at any point it becomes a different sensation. So it should feel the same coldness on both sides. And is that the same here? Same? Same. Okay. So one more. I'd like you to tell me if this here is the same. Good. Okay. So no difference in sensation there. Okay. So at this point, I think we can go ahead and rule out any further injury aside from this sprain. So I would categorize this as a grade 2 sprain. So it's going to take you slightly longer to heal. I'd estimate your healing time to be anywhere from 6 to 8 weeks. You don't need to have it in a brace in that time. I would, however, like you to keep it wrapped. So I will wrap it for you now. As soon as you wake up in the morning, you should wrap it to help accommodate the swelling. And then before you go to sleep at night, you can go ahead and take the wrap off to give yourself time to breathe, allow your skin to breathe, and allow for the circulation to kind of work itself out. I would like you to be icing it ideally every 2 hours for 20 to 30 minutes. If not, every 4 to 6 hours is acceptable, permissible, but if you can, every 2 hours is really going to help alleviate some of that swelling, okay? As well as keeping it elevated above the level of your heart. So you want to allow for circulation to move down and out of the ankle. So we'd like to keep your foot above the level of your heart. So just to demonstrate that, when you're elevating your affected leg, you want it to be elevated at least to here, okay? So a lot of my patients tend to elevate their leg just a little bit, maybe 1 pillow. If you're using pillows, I'd say 2 to 3 is ideal, okay? And you can elevate and ice at the same time. So what I'm gonna do now is wrap your foot. And this is how you should be wrapping it at home. So we want you to wrap it so that your foot is kind of at a 90-degree angle, and that's going to help maintain the muscle as well as ensure that it's healing in the proper position. So you don't want to wrap it in a way that's going to constrict your foot crooked. You want it to be straight and preferably at a 90-degree angle between your toe here and your calf, okay? So just using a regular ace bandage. You can use a compression sleeve if you'd like. So for the purposes of your examination today, I am just going to go ahead and wrap it for you. So I'm going to start a little bit higher than the injury, and I will just move this up slightly here. Okay. So you want this to be taut, but not tight. So not tight enough to cut off your circulation, but you do want it taut enough to where it is going to help with the swelling, okay? So just putting it on here very loose will do nothing for you. You do want it to be a little bit taut. So I'm gonna pull this here and wrap. Try to make sure that that Velcro is not touching your skin, and you'd like to overlap if you can at least halfway with the previous row, okay? So I'm going to help you hold your foot up. We're gonna tuck that underneath. So we're gonna overlap it slightly there. Pull it taut, come down. And as we do this, we're moving down closer to the injury. And what I'm gonna do now is go underneath your ankle. So I'm gonna wrap it around this way. And then when I come up, I'm gonna wrap it underneath your foot, and that's going to help keep it in that 90-degree position here. So just like that. And then I'm gonna wrap it coming back towards you. We're gonna go up one more time. Good, go ahead and relax. And we're just gonna fasten it here so that it doesn't come undone. Now, as you can see, I've wrapped it so that it is slightly taut. You should be able to still get your fingers underneath here pretty loosely. And I have it wrapped under your foot almost as an anchor to help keep your foot up in this position here, okay? So you want to keep it wrapped. When you ice, you just ice it around the wrap, okay? All right, so that will conclude your injury assessment today. I am glad you are feeling a little bit better. Of course, we still want to promote healing. So my recommendations moving forward would be to continue wrapping it as described today. I also would like you to ice it every 2 hours if possible. If you don't feel like you're healing fast enough, or you feel like you're still having a lot of pain, over a 6, 7 out of 10 pain when you're taking steps on it in about another 2 weeks, I would like you to come back so we can redo your injury assessment, okay? In about another 2 weeks, it will be 3 weeks from your injury date, and by that point, you should still have pain, but you should be able to take mostly normal steps and put full weight on your foot, okay? Okay, all right, well, thank you so much for coming in, and I hope you get to healing. Have a good day.